everyone for coming. I'd like to welcome you today to the seminar as well. Today we're going to be looking at the seminar called Measuring the Outcomes Experienced by Consumers of Community Services. And in starting, I'd like to acknowledge our research partner Uniting VicTaz, and also my colleagues on the research team, Dr. Robert Campaign and Dr. Chris Brown. So the focus today is looking at what are the outcomes of community services for those who use them, and also to look at how we measure them. So the shorthand I'm going to be using throughout this presentation is that of consumer outcomes, and by that I mean consumers of community services. So let's just start with laying out some of the groundwork, some of the starting assumptions. So the first thing to say is that there is no perfect outcomes measurement approach. If there was one, we would be using it. So there's not one in government, and there's not one in NGOs. So what we'll be talking about today is one approach, and it's not the perfect approach, there never will be one, but our approach we've tried to take is pragmatic and critical and realist, and I hope that I can explain that to you today. Nor is there any sort of easy off-the-shelf fix. Whilst there are, thousands of approaches and many outcome frameworks and lots of instruments to measure outcomes, each one of these has its limitations. So whilst we can select those to use, and of course we will in certain circumstances, it's not that we'll ever find the perfect fit. We know too that there are considerable resources needed in the outcome measurement space. We know that we need resources to both collect and analyse the data, but also to make use of the data. And this is an area that organisations often struggle with because whilst they may have data, they don't always make full use of it. And finally, you can't do everything in this space. There's many things to measure, and we have to make decisions. So it's about making choices about what's most valuable to do in any given context. So one of the first things that we need to do in taking an outcomes measurement approach is to think about what's the focus of the work? Where are we looking? Because we have some choices. So we can focus at the outcomes and impacts level, and this focuses our attention on questions like, are we making a difference? Does what we do work? And are the results sustained? We could also focus at the process level, that is, how does it work? What makes it work? What are the key ingredients of practice that are contributing to these results? Or we can focus at the output level, the volume level, how much are we doing? How many people are experiencing our services? Today, we're only going to look at outcomes. So I have shared all of the slides and all of the information that I would love to talk about in relation to process and output. So to continue this discussion on definitions, let's talk terminology and vocabulary. The outcomes measurement space is rife with confused and confusing vocabulary. I don't think we're ever going to change that. I think it, to some extent, is subject to context, and so we just have to live with it and work out what people mean by the different terms when they're using them. So for the purposes of today, I'm going to use the term domain to refer to a broad concept that might encompass multiple outcomes, such as, for example, social inclusion, clearly a complex phenomenon. The term outcomes framework relates to a conceptual tool. It's not the instrument in itself of measurement, it's the way the pieces of the process are held together in a framework. So for example, social inclusion framework. An outcome is a specific change achieved or intended, such as inside social inclusion, this broad concept, one of the outcomes that have been mentioned is this one of service inclusion. Then we step down to the level of indicators, which is where we start to flesh out what do we mean by these outcomes and how do we observe, what do we observe when we see that they're being achieved. So this is the concretising really of the space. And sometimes the term descriptor is used instead of indicator, and for the most part I will use descriptor when I talk about the work that we've been doing on the Uniting VicTaz Consumer Outcomes Project. So an example of an indicator or a descriptor in the social inclusion space is medical treatment if needed. So you can see that this might be a descriptor or an indicator that we might use to measure service inclusion. But then we get down to the measure itself, the actual question or item that we're using to establish the data. And in this case, the question that I've taken from a previous national poll that I was involved in is, think about the following life areas over the past 3 months, place an X in the space that best represents how well your needs were met accessing medical services. So you can see the level of detail, but you can also see how we've moved from a very broad concept down to a very, very specific concept. So in this process, we're shifting and narrowing the concept as we go. The Australian Bureau of Statistics suggests that there's actually 5 key stages in any outcomes measurement framework development. So they suggest that the first is to decide, obviously, what are the desired areas of change, so what are the outcomes and for whom, and then acknowledging some of that complexity we just spoke of in the previous slide. They suggest that we need to go and unpack those complex terms, then identify the more concrete indicators, what will we see if change occurs, and then think about how to measure these indicators or descriptors, how to collect that data. And finally, but not least, to think about how to analyse and present this information so that it's useful. And this is a really critical point because it's one that we don't always get to. A lot of time is spent often in developing outcomes frameworks that never actually hit the road in terms of data collection. And even when we get data collection, we still struggle to use that data in ways that's useful for community services. Just to explicate this a bit further, here's an example from the current National Disability Strategy. In this strategy, they identify 6 core areas or outcomes. So the first of these is inclusive and accessible communities. Inside that larger, it's really a domain, are a set of outcomes. I think there are 6 or 7 of these that then unpack what do we mean by inclusive and accessible, and I've given you 2 here. So one's around accessible and well-defined, designed communities, and also the inclusion in social, economic, sporting and cultural life. The other was really around the accessibility of the built environment and maximising people's participation in the regulatory systems about that. Now, interestingly, in the National Disability Strategy, there's only 2 draft indicators in relation to this entire domain, and I've put them on the screen there. So one's around people using public transport, and the other is around participation in various activities. So again, you can see this narrowing down of these measures that then are going to represent this overall domain. So when we're in this space of trying to decide what are the areas of change, you know, what are some of the things that we need to think about? So we know that in community services, most organisations and even a single service itself is likely to have many outcomes that are of interest to them. So these might be social inclusion or employment or autonomy and choice or safety, and a single service might think that they're attending to all of those things, which they probably are. So how do we then select what we name as outcomes? So obviously the first place to look would be a program logic or a theory of change. But not all services have the advantage of having that structure to guide them. So then we might think about what is the policy, program or funding intent that the service or organisation sits inside. So can we draw on some of that logic and some of that naming? Clearly the priorities of consumers, what they want to achieve, should drive everything. We also might want to think about the time frame and scope of the outcomes. Are we interested in short-term outcomes? So for instance, are we interested in measuring whether or not somebody achieves work experience as a short-term outcome, or are we interested in measuring whether or not somebody has gained and maintained a job as a longer-term outcome? And this sometimes depends on how the service is pitched, so it may only have the resources to address the short-term outcome. We might, for instance, think, let's just wheel in some outcomes from somewhere else. Somebody else has done the hard work of naming them, so let's use them. Fair enough. And we might decide that actually we really need to link to other data to help show how we're tracking in relation to someone else. And in that space, of course, we need to use the outcome measures and outcome names that others have used. To add to this, there is, of course, the additional complexity that we don't use the same language for any of these core domains or outcome concepts across the sector. It's incredibly complex. So for some, we might talk about social inclusion. Another outcome framework might call it social participation, and yet another might encapsulate these inside a social cohesion. So already it means that the domains and outcomes are not transparent. Meaning is not universal. It's not inherent in the concept, unfortunately. And to add to that, we know that outcomes can be measured by a range of different indicators. And as you've seen, each indicator takes the concept in a bit of a different direction. So depending on what we select, the concept will be somewhat redefined and retuned, if you like, in a different direction. Using established indicators is great, but they may not be the perfect fit for the thing that we're trying to measure. So horses for courses. We've got to make our selections based on a range of factors, and we need to consider purpose and context. But overall, the bottom line is we need to be selecting outcomes that are meaningful. They have to capture what's most important to the people most affected. Pointless to measure something just because the measurement instrument exists, but it's left of centre of where we need to be in terms of what we're trying to achieve for the people we're working with. And we need to make sure that the data that we're collecting is influential. It needs to be useful. We need to not waste time on collecting data we're not going to use. Second to that, we need to make sure, I think, in any outcomes measurement process that we pair it with identifying ways to improve service design or investment design. So we need to look at what affects outcomes, what are the barriers and enablers to outcomes. I think there's good argument to also look at the process indicators, that is the key ingredients of practice or service delivery. Because without these, we won't know why something has worked and we won't then know how to replicate it in future. This speaks to, I guess, the limited usefulness of things like scorecards, which have their purpose in an advocacy sense and for other reasons, but in terms of improvements, don't say a lot. So this brings us to where we're up to in our work around the consumer outcomes report framework, which is some work we've been commissioned to do by Uniting VicTAS. So Uniting VicTAS is a large not-for-profit service organisation delivering services in a whole range of areas, as you can see on the screen. They deliver in 2 states. And because of this diversity of service focus, it offers a really useful case study for as an example of looking at how we might measure outcomes across the sector as a whole. Excuse me. So Uniting VicTAS has 3 levels of consumer outcomes. So using an ecological model, we can see that they're targeted at the consumer level or the micro level. And in this instance, they refer to life outcomes being maximised for consumers. They also target change at a community level. So looking at influencing the enablement of inclusive, just, thriving and connected communities. And then significantly also looking at the macro level, influencing public policy around issues of injustice. So clearly, as we would expect in a consumer outcomes focus, we're looking at this outcome of life outcomes being maximised. So the consumer outcomes pilot is seeking to do a number of things. We need to develop an outcome measurement framework for Uniting VicTAS because there isn't at the moment a whole of organisation framework for understanding what the outcomes are beyond that I've just shown you for consumers. We need to establish and test a data collection method using self-report of consumers, very committed to that principle, and to test how that data will be used in the organisation. So if we collect the data, will it be used and how can it be used to best effect? And all of this will inform an organisation-wide measurement approach, which is quite complex, as I'm sure many of you understand. So there's a number of problems that we encounter in tracking this through. To some extent, they mirror what I've just been speaking about. So you can see from the previous slide that Uniting VicTAS has a breadth of outcome areas. Across those services, you can imagine a wide array of outcomes. The outcomes themselves are quite complex concepts and they're multidimensional constructs. So they're not, as I mentioned, they're not immediately meaningful necessarily to consumers unless we're going to use that language coming back up. We need to operationalise it by a lean approach. So to make this viable for the organisation, so given the limitations on community service resources, we need to consider, what's possible in the organisation as far as collecting, analysing and collating that organisation across the organisation as a whole. And the leanness also applies to what's appropriate to consumers. Consumers are not always keen to engage in feedback. And there is burden attached to that. And most importantly, we need to identify the attribution. So that is, what was the effect of the service on outcome? So problem one, the breadth of the outcome domains to be included. So we need to think about, how do we name all of these outcome areas that are targeted by community services? So there are, we know, multiple human services frameworks, human service outcome frameworks around. Many community service departments in multiple states have them. And there are also many sector outcome frameworks, such as those available in the homelessness sector, for instance. And they all have differently named domains. There are different names in use, different collections of concepts, so that makes it complex. Services report that they in fact target multiple domains, and as well, not simply just those that are the ones that they've been funded for. So again, this adds to the complexity. For instance, if you're a housing service, it's quite likely that not only are you seeking to support people to access housing, but you're also seeking outcomes in relation to safety or social inclusion, given that these are often part of that landscape of what contributes to a particular issue for a person. So many community services, and some of you I know listening will be thinking, absolutely, I completely understand that issue. And one of the common solutions has been to think about utilising a more whole of life outcome approach, something like quality of life or the personal wellbeing index, which is a validated instrument. So these kind of approaches seek to capture all of those outcomes that might be relevant to the organisation and report them up in terms of this overarching quality of life type framework. And that can be very useful. I've seen some very useful examples of organisations doing that, particularly where it can give some good diagnostic information about the cohort, so we can look to see what parts of the cohort are most affected in certain quality of life areas, for instance. So it provides a range of useful information, has a few problems. One is that the domains of the approach, such as quality of life or personal wellbeing index, may not be particularly well matched to the service, or maybe at perhaps too high a level for the service. And we also have to accept that anything we wheel in will come with its own theory that sits behind it. And that theory may or may not relate to the community services context. So this is an example of the Personal Wellbeing Index for those who aren't familiar with it. This is actually an older version of the index that we used in a national poll some years ago. Since then, they've dropped the item 9, spirituality or religion, and the item 1 is not always used either. But you can see that across these dimensions, we're starting to hit, quite a wide range of life areas, and we can probably see that things like standard of living is a bit of a proxy for housing, for instance, possibly for income. We might see that things like what you are achieving in life might be a proxy for things like employment and education or other recreation and cultural activities, perhaps, and feeling part of your community might align to something like social inclusion. So you can see how this could be used. The second problem that we have is that outcomes are multidimensional, and which we need a way to try and explain them to consumers who are going to report about them. So we need to think of methods to get to this level of specificity and transparency about what the outcome means, but to maintain this breadth of outcome and not overly narrow it and lose parts of it that might be relevant to the service and consumer. So often the approach here is to adopt an established validated instrument, as I've already suggested. And again, we have to accept the limitations of this. So usually these instruments are based on a particular construction of the concept, and that concept has been validated in this particular construction. So it doesn't apply to every other way we might use this concept, but only to the way the concept is used in this instrument and for the cohort for which that instrument was constructed. That's how it's been validated within that cohort. So using these kind of approaches means that we are necessarily going to limit the number of dimensions that we might look at in an outcome. And we won't necessarily want to use multiple validated instruments, or we'll start to overburden our consumers. Another approach here is that services have chosen to draw on the existing data that sits inside services. And this is a really important data set and would be wonderful to unlock, although of course it does have its limitations because it's often speaks to things like output. But in some areas there's the use of clinical assessments at pre and post service, or other kinds of intake diagnostics and then further diagnostics as the service proceeds. So these can be really useful. The trick is to be able to extract them out of the service and aggregate them beyond this clinical or service setting. So that's quite complex. The other problem is that they might only capture one outcome or one dimension of the service because they're targeting a particular aspect of the service. And they may not be targeted where the service is making a difference. I'll explain that in a minute. And they're often very lengthy and not particularly user-friendly sometimes. This is an example of one. It's often used in mental health and alcohol and drug context, the Kessler 10 psychological distress scale. So it is terrific at measuring psychological distress, which is great. The problem is that in some of those services, mental health and AOD, for instance, whilst we do want to know what's happening with psychological distress, we also want to know what's happening with other sorts of outcomes. So it speaks to one outcome potentially, but not necessarily to the others. So how have we responded to this? As you would expect through my conversation, we have decided that in fact the whole of life type approach doesn't marry well with the organisational requirement in this instance. So we're wanting to be able to drill down to specific service outcomes or outcome domains in relation to things like financial capability, for instance, which is not transparent in these broader overarching types of approaches. And we haven't been able to find a suitable existing match that covers the organisation in an existing framework. In terms of using the validated instruments and wheeling some of those in, we've decided that really they're overly narrowing the construct, the outcome construct in this context, and that we would, given the number of service types, we would need many, many validated instruments to be used, and this is starting to become quite problematic. And not only that, but some outcome areas actually don't have any. So we're back to the problem of what do we do? When we think about using the existing data, whilst that would be a wonderful and aspirational ideal, at the moment that's not possible. We just don't have the capacity to extract and aggregate and analyse data at that level. There's no centralised process to do that. And in addition, quite a number of service types don't actually have this data anyway that in any way relates to outcomes. They may have output data, but they don't have any kind of outcome proxy data at all. And nowhere in these has there been an attribution link. So what have we done? We've done exactly what you would expect us to do. We've gone and looked at everything we can look at. We've looked at consumer outcomes frameworks. We've looked at government policy and the outcomes that they fund and value. We've looked at the research literature, which tells us a bit about this sort of the logic of outcomes and what we would expect to see over time and the way that outcome trajectory might evolve. We've looked at and talked to services about the outcomes frameworks that they use, and we've asked them about the outcomes experienced by consumers. And of course, we have talked to consumers themselves and are completing a consumer consultation at the moment with them about the outcomes they value and how they name them, etc. And to varying extents, of course, the consumer voice is across all of those things I've just talked about, because much of that is based on a research literature engaging with the consumer voice. So from there, rather than just making a list of all of the options available to services and letting them cherry pick what they need, to develop an organisational wide approach, we've worked towards a content and thematic analysis that has, from that whole resource set, developed and identified out a set of outcome domains, and then a set of outcomes and descriptors, that is the themes or elements that comprise the outcome construct. Because we're able to see looking across all of that, quite a high degree of saturation. So there is a level of concept agreement. There's also a level of concept disagreement, but we've been able to thematize this into a set of domains and outcome concepts. So this is where we get to the fun part. So this brings us to the development of an outcome tree for the organisation. So what we're trying to do is unpack what we might mean by this broader outcomes idea of life outcomes being maximised for consumers. And so we have named a range of domains, remembering that these are the large concept areas, and we've tried to keep these domains conceptually distinct. I'll come back to that word tried to or attempted to in a minute. And similarly, we've tried to name the domains in ordinary language that has some level of face validity. That is, someone can look at it and go, I know what you mean by housing. That's not always easy. And ultimately, the data can be aggregated up and analysed against these domains. So in terms of that comment about we've tried to, clearly there are issues in keeping domains conceptually distinct. I'm sure you can look at this list just right away and see some immediate problems. For one, as soon as we use the term capability, that's a really tricky term, so that might have to go. And in terms of keeping domains conceptually distinct, social inclusion, what a doozy. And depending on how you define that, it could easily wrap up around some of these other domains. So, as I said, no perfect fix. Under each of these domain areas are a set of outcome branches that I'm about to show you. And again, each of these, we've tried to keep the naming and the outcomes conceptually distinct. So rather than wrap up things like safe and affordable housing together, as has been done in some of the outcome frameworks, we have separated these out. They're quite separate things. One is safe housing, the other is affordable housing. So each domain is then populated by a set of outcomes, which are outcome branches. So this is the outcomes tree as it stands at the moment, and it is still a work in progress, but it has been tested with services and we're finding it's holding up well. So our process, which I'll explain a bit further in a minute, has been to, as I said, work with that literature and extract the outcome themes and validate those through a process of inter-rater agreement with the research team. We're still populating this, so you can see that there's some gaps under justice and agency autonomy, and we're still open to the idea that we haven't got them all. We haven't got all of the domain areas, nor have we quite got the outcomes nailed yet. There's a few domains that are still undergoing inter-rater agreement. One is health, so don't get too worried about the definitions and boxes just at the moment. Actually, before I go on, one more thing I'll say, what's been interesting about this has been what we've found in talking to services, and one example is the fundamental basics domain. This is not a domain that you find on really any community services outcomes measurement framework that comes out of government in Australia, partly because we assume that it's there, I think, but services are telling us that this is often the level of work that they're doing. They're providing shelter, they're providing sanitation, they're providing food, and often the outcomes go no further than this. But unless we recognise these, we just lose this work and we lose the demand from consumers about this. So we've tried to capture this. It's much more akin to what we would see in international development. So as I mentioned, our process is then that under each of the outcome areas is a set of descriptors that come out of all of the resources we've looked at. This is just one example relating to one of the outcome areas in social inclusion, and that is the outcome area of social support. So there's a set of descriptors that come from a range of sources which we document, and some of those are, have multiple sources for each descriptor. Services take this map and they select the priority outcomes that they want to measure. So we've tested this as a concept, it works well. What's really nice about it is that services can step out, if you like, of their funded primary goal in terms of something like, say, housing, and start to select priority outcomes that best represent their work in other areas. And that's a really interesting phenomenon to see. So we're asking people just to select 2 or 3 outcomes, again, thinking only of the leanness of the data collection approach. And we'll be able to analyse all of these outcomes at a service level, a service stream level, and at an organisation level. So once outcomes have been selected, then this moves through a process of then a set of survey questions that are predetermined that relate to each of those outcome areas that then is used to populate a survey pro forma, which we have, which I'll tell you about. So it's quite a streamlined process. All that work is done at back of house. The data collection format is, as I said, relatively brief as we can make it. There's a very few demographic questions. There's a question in relation to what we might call service dosage. That is, how long have you received the service? How much service have you received? And this is to try and distinguish different types of service. Then we wheel in the first outcome priority area and the question set that relates to that gets populated. Then we have a look at the barriers to that outcome. So what was the biggest barrier that got in the way? And this helps us think about how to address those barriers in future service delivery. We then wheel in outcome 2 and rerun the process with the question set. Then we offer consumers an opportunity to reflect on other outcomes, remembering that the outcomes that are populating the survey are the outcomes selected at this point by the service. So the consumer may have had different outcomes that they valued. Of course, we could use consumers to populate the survey, and that's something that we will think about. Then we go on to look at question around service improvement, and we offer a strategic question, which services might populate depending on what's going on in their context. So this is an example of the survey format at the moment at the domain level. Don't worry too much about the rating scales. I know some of you will be have lots of concerns and questions about the rating scales. We're still testing this and we're not yet convinced that we have it right. It's gone through some early testing, but we need to keep working on that. So at the moment, let's just focus on how this survey has captured at the domain level the concept of social inclusion. So you might remember on the previous slide, the service had actually circled social inclusion as a whole. So if services want to actually pick up all of the outcome areas in social inclusion, then this is the way that the question set populates. It asks a question of the consumer about social inclusion and asks them to rate how they were travelling in this regard before they came to Uniting around each of these outcome areas: social contact, social support, participation in community activities, feeling valued, etc. And also to rate how they're travelling after or currently. And then we ask them to rate the impact of Uniting on this particular outcome area. Or they can choose just to focus on one of the outcomes themselves. So this is the question set for having a say. What's useful, I think, at this level, at the outcome level, is our approach has been to describe to the consumer, what do we mean by this outcome? So we say to them, by having a say in community, we mean being able to have a say in the general community, feeling like you have a stake in your community and society, voting, having a voice to raise your concerns and views. Now, this definition comes from the descriptors that I just showed you an example of. So it comes directly out of the literature and out of the existing frameworks and other indices. So it tries to capture that outcome concept and construct as a whole. So again, they rate a kind of pre and post, how they were travelling in relation to that and the impact of Uniting on that. So in summary, what we've been trying to do is to build an outcomes measurement approach that can be customised to service type or service location based on some kind of design logic, but that we can still aggregate and report against the same measures in the organisation as a whole or in a service stream as a whole. So that customisable versus the overarching report are the two things we've held together there. We have tried to define but retain the complexity of the outcomes construct, and we've enabled this to be reported, data to be reported at an organisation level, a service level, or a stream level. And as I've said, the measurement approach is based on explaining the construct to the consumer and letting them rate it, asking the consumer to do an attribution rating, that is the effect of the service on the particular change, and we have tried to activate a commitment to lean data collection. Clearly, there are many limitations in this approach, as there are with all approaches. It does provide useful data, but doesn't provide all the data that we might want. And clearly, we still will need to think about what other forms of evaluation do we need to run to understand what's happening and to inform our investment and service design decisions. Our ongoing challenges are around how to collect the data. In pilot, we'll be using multiple modalities of phone, online, iPad, face-to-face. Down the track, we're very interested in investigating peer researcher models, and we've already begun those conversations with consumer groups in Uniting, and potentially the idea of a consumer panel where consumers might opt in to be remunerated for providing feedback on various points that Uniting might seek to ask them about. We have to attend to burden. You know, if we've got ongoing intake and assessment data happening and other service level data collection, we have to be very careful about what we ask consumers to do. So hence the lean approach. We know that engaging consumers is going to be very difficult, particularly in some services, and there's lots of reasons for consumers to be disengaged or even suspicious of service follow-up. So we need to engage with that. So hence why we're talking to consumers. We need to sort out this issue of timeframes of data collection, given we've got some services that provide incidental or occasional or one-off services and others that are designed around longer-term intensive interventions. They've got very different timeframes about when we would expect outcomes to reasonably be attained and evident. This speaks to the problem of capturing service dosage in some form. And also, we really want to attend to how we're going to use this data. So to conclude, we're moving on now in concluding our consumer consultation. We have a pilot underway, which is testing data collection in 3 service locations in rural and urban locations across 3 different service types. As soon as we can get out of lockdown, we'll be back on the ground in that space. And once we've finalised, once we've concluded that pilot, that'll inform our design of the data collection approach and also of the tree itself. We'll be expanding out to different service types, given we're only covering 3 service types. There's a multiple in Uniting at the moment. And we will certainly be open to updating and expanding on the outcomes tree based on demand and also based on how it best represents the community sector as a whole. Ideally, we'd like to link to or access funding and resources to build the software platform that actually automates this survey construction. All the pieces are there, we just need the platform to make that available to anyone in the sector. So that's it, and I would encourage you to engage in conversation and critique and questions, and should you wish, please, please make contact with me at any time. Thanks.
Thank you so much, Erin. That was really interesting, very thorough, and we appreciate your presentation. Thank you. We've had a few questions, which is great. We encourage others to submit their questions in the chat feed, and I'll facilitate this with Erin now. So I'll just read out the questions, Erin, and then if you could answer, that'd be great.
Sure.
So from Sally first, how is it best to manage the ethical considerations of implementing a tool, such as the Personal Wellbeing Index?
Ethics and community services. What a lovely curly one to start with. Thanks, Sally. No, many and varied answers to this one. Obviously, when you engage a university, ethics is even more apparent because we have very clear ethical obligations. There is this quandary about does ethics apply if we're talking about quality improvement work versus research and evaluation work. And there's a bit of a line to be crossed there. I think so. There's a set of decision points to make in that regard that organisations might engage in. I think in terms of the ethics issues for us, clearly we all want to work in an ethical way. So let's just lay that aside. There are ethical principles that we want to adhere to. I think some of the challenges in it are the additional requirements that might come from complying with something like a full ethics approach in a university setting where we're seeking consent in quite detailed ways from consumers about their involvement in any kind of outcomes feedback process. So that can be burdensome for consumers as well, because it comes with, you know, plain language statements and consent forms and things like that, and we need to prosecute those in particular ways. Now, there's ways that we can make those a bit more user-friendly. But other things to attend to, I think, in community services is to think about the consent that we ask for from consumers at the front end of the service. So some services have managed to comply with our ethical obligations by asking consumers if they consent up front to the service following them up after the service has finished or down the track to seek feedback on services in terms of outcomes measurement. And that's a really useful way to go. We don't always do it, and we don't always do it in writing, but if we can do it in writing, that's helpful, and ethics committees can accept that as evidence of consent. So I think we need to think more about some of those front-end conversations with consumers about what we might want to do and why we might want to do it and what our accountability is to them.
Okay, thank you. From Nicole, how do you balance service providers' need to invest in relationships with customers with the data collection needed for outcomes measurement?
Yeah, it's a really interesting one, Nicole, and our service staff talk about this all the time. What was really interesting in the pilot, we went into services saying to them, we don't want to ask you to do any extra work here. We're not going to ask you to do the work of data collection with outcomes. We're going to do it for you, because we'd heard from people that they were very overwhelmed with their workloads and that they wanted to maximise their time in that relational and service delivery mode with their consumers. Completely understand that. Interesting, when we went through the process with them about implementing the approach, we got a really different response. So people started stepping back from that and saying, actually, we could do this with consumers. This could actually be part of our relational response. We think we've got the relationships to get these kind of feedback, and not only that, we need to hear it. So it's an interesting circular discussion about does this kind of data collection undermine or support the relational process? And to some extent, it depends on the relationship. So it's a really tricky one. So good question, Nicole.
Another interesting question from Chris, which is adding to Nicole's question above. Can't one make the data collection a positive part of building relationships with customers?
Yeah, I think a lot of this is about that. Partly back to the first question, the upfront conversation and some of those conversations that ensue after that, which is about what are we doing here together? You know, why are we here, and what's the process of working together? And that part of our process as a service is accountability to you as a consumer about, you know, is this working for you, and what makes this work for you, and are you getting where you need to go? So I think if we can have some of those conversations, that's helpful. The problem is when we have multiple instruments. So there is a lot of discussion in the space about how or should we use some of the goal setting instruments, for instance, in individualized service delivery as an outcome measurement instrument. So whether we should try and extract the data from that and aggregate it up. Because then that's clearly the relational space. We're talking about what's important to you, what are your goals, and how are we going and getting there. And so that's an inherent part of much practice, depending on your service model. So that's a very useful approach relationally. Does it work in an outcomes way? Possibly, except that there's not great evidence around how to aggregate across those instruments. And so there's a few problems in doing that. So there is this push and pull between what we might wheel in kind of over the top that sort of feels a bit like an add-on to a service, especially when we've got this other methodology in the service that's driving a bit in the same place, but not quite. So I think that is a really tricky conversation, and I agree, not an easy one to fix.
From Kirsty, are the domains on the COR framework in a hierarchy order?
So the domains in the tree, I'm presuming that you're suggesting there's no hierarchy, no.
Okay, Kirsty, if there's an additional part to that question, sorry, Kirsty, please add that in the comments. From Imogen, she'd really love to hear a bit more about peer research models that you are exploring.
Hi, Imogen. Yeah, so as you know, peer researchers are probably used most in mental health and to some extent disability. So there's a whole, inclusive research model in disability that's engaged particularly with people with intellectual disability as researchers or co-researchers in processes, and in mental health likewise. I've been involved in a number of projects where we've used peer researchers. So, and in other programs as well. So peer researchers, obviously, we need to think about a number of things. Remuneration. So it's a bit of a conversation about, are these real jobs, or are they honorarium type advisory roles? The position I think that the Uniting Consumer Partnership Steering Group has come to is that they're actually real jobs. They're pieces of work that need to be adequately remunerated. So we need to look at the remuneration process, and also then obviously the professional development and training process around that. So we need to consider how and when they're useful. I think in my experience, they've been very useful when we're seeking quite qualitative data, and the engagement of a peer in that process of conversation, it's a dialogue about what's happened, as you would know, is really helpful. It'll be interesting to see what peers think about engagement in this process, and yet this is the piece of conversation I haven't had with the Consumer Partnership Steering Group at Uniting. While we've raised the idea and we've talked about it in principle, they haven't looked at it in thinking about how would they administer such a tool as we have, and how does that sit with their positioning with their peers and in Uniting. So we can talk further about that, Imogen, when I've got more of that information.
From Helen, it's a little bit of a long one, so bear with me. Did you find it might be hard for a client to have a concept memory of how they felt about a domain before entering the service, when they're being asked to assess that a number of days, weeks, months after they have already been supported by the service? Or is the before part done at the start of support? Thanks, she said.
Yeah, it's a really good point. How do people remember where they were at? This is a thing. And this is the conversation about, what's the most valid or accurate measurement, and how do we rate it? In some ways, we should rate it at the beginning. We're just not likely to ever be able to do that in most instances in Uniting. So it's absolutely one of the limitations. How do people reflect on that? In some ways, though, they might reflect on it. This is the other argument, that people become more self-aware as they engage through services. So they actually understand more about their situation and how far they have come or where they were in relation to their situation. So it's a very subjective and interpretive issue, I think. And it probably depends on your own paradigm or the organisation's paradigm as where they land on that, if they want to go for a standard pre-post measure and really put efforts in to collect that data right at the beginning. So you could ask people right now when you walk in the door, how are you on this particular outcome? And we could test that and see, what the differences are in asking people later. So that's about as good as an answer as I can give at the moment.
That's a great answer. Thank you. Christine asks, how will data be collected? For example, paper, online links, interview?
Yep, so at the moment, Christine, we're hoping to try all of those modalities. So we'll use the same survey format. So if it was a phone chat, we'd just go through the survey by speaking it out and telling people the options. We'd have an online process, and we're thinking about some face-to-face, drop-in sessions and chat sessions in services. as I say, the staff, even though we offered to leave them out of the data collection process, are all desperately all now trying to wheel themselves back into the data collection process and are wanting to take out the survey instrument on their iPads when they go out to people's homes in some services and sit down and have this conversation and capture it. So we will pilot a range of modalities, and that's part of the pilot, is to actually see what happens when you do different things. What happens when you use external researchers to collect this data versus what happens when you have staff collecting the data. And there's, again, pros and cons of both. You know, some services will think, oh, you know, it's incredibly biased when you have the service staff member who's been delivering the service collect the data from a consumer. There's a whole lot of issues inside of that, as far as, you know, feeling that you need to keep the consumer needs to keep the staff member satisfied and keep them on side, and they feel at risk of losing service, etc. Whereas on the alternate side, there's also a rapport and a relationship that's built and a meaning making between these two people that can lead to some very comprehensive, you know, understandings between each that make that even a more accurate data collection. So again, there's just no simple one answer for this. There's a set of decisions and a set of limitations, and we need to name them both up in all instances.
Wow, I found that really interesting. Very interesting. I know Catherine also asked a similar question. Thanks, Catherine. Nicole asks, how has COVID impacted your work?
In this project, the work went on hold fairly initially, not just because of the issues of data collection, but also because we didn't want to collect data about something else that was happening. So if we're trying to look at what are the outcomes of services, and then we have COVID happening and services are doing all sorts of things and all sorts of consumers are coming to services, we didn't want to muddy the water with a whole lot of separate issues. So we've just postponed for the moment in terms of that data collection, but clearly we can't wait forever, so we're going to need to get back into it. In the meantime though, we wheeled in a different set of research, which was asking services about what actually had changed and where their demand had changed during COVID, and what were the resources and issues they needed to help them deal with that, and looked also at the extent to which that demand was meeting the eligibility requirements that the service was set up around. So we've got some interesting data from that. So we did the classic pivot, as much as I hate that word, and went somewhere else in the meantime.
Yeah, there's a lot of pivoting going on at the moment. From Heather. How long did it take to get to this stage in money terms, people involved? And overall, sort of a two-part question, overall, this looks like something for a well-established organisation. How do smaller organisations start this sort of thing and achieve that level of credibility?
Yeah, quite a multi-barrel question there, but a good one. So we've actually been incredibly rapid. I've done numerous outcome measurement projects in my career, and this one's a pretty fast one. So we've been operating for a little over 12 months, and in that time we've developed the outcomes framework as well as methods of data collection, so all the way through. So often you can take a year or more in coming up with your outcomes framework and tracking that through the organisation, etc. So to some extent, we've set to the side of the organisation. So we move in and out of the organisation as we need to. I think, so we've been pretty fast in being able to track to that. What might happen next is that it needs to get broader approval all the way across the organisation, both horizontally and vertically. So it has some of that, but it'll need more of that. And that might slow things down, I think, as we go forward. So the short answer is it's been about a year. We have had the equivalent of parts of my full-time role and the equivalent of another full-time role working on it to do that, although they've had some other tasks to do. So that's the kind of investment, a couple of people probably for a year to get to this point. In terms of smaller organisations, and I have worked in smaller organisations as well, it's really about focusing on, I would probably start with a theory of change, and then you can identify what your outcome areas are, and then picking off perhaps a priority area and even commissioning or getting some advice just to tackle a way of designing a way forward with that. So we work with different organisations in different ways around how to do that. So for example, one organisation we're working with at the moment has just committed to making a top up to a PhD scholarship, and we'll have a PhD person on board for 3 years to help work with that organisation to help progress this kind of activity. So there's ways and means of doing it. And or you can use other people's. I would hope that our stuff might be useful for you and it would be freely available, you know, if we can get it out to you.
Great. I'll just end with one last question. There are a few we didn't get to, so when I follow up tomorrow with the survey, feel free to respond to me with your question and I will pass it on to Erin. From Matt, does Uniting VicTaz have any detailed theory of change diagrams for these programs with arrows? And is that a prerequisite or can this work without them?
Oh, theory of change, Matt. Good to end on a curly one. Some organisations have, some parts of the organisation have very detailed theory of changes with arrows, but I would say most do not. And this is one of the problems. One of our methods initially was to run theory of change workshops, but we were almost about to go ahead with that and we realised it just wasn't going to work. One of the problems in doing it is just getting access to service staff and stakeholders at the same time to do something as intensive as a theory of change with them. Because of the way they're funded, they just didn't have the availability to get free. So we could work with a couple of people at a time, but it's really not sufficient if you're going to do a theory of change process. So we're still working out what might be a theory of change methodology for Uniting and how we could roll that out in terms of Uniting VicTaz. And I know you'll have similar issues elsewhere. So good to keep talking about how do we enable services to do this kind of service design work when they're essentially not funded to do it.
Wow. Thank you so much, Erin. We've come to the end of the time now. So as I said, any questions, respond to me and I'll get them to Erin. Thank you so much, Erin, for the presentation. And
thanks everyone.
Thank you to our attendees as well. This is our second last webinar, as I said. I'd love to see everyone at our final webinar, which is with David Gonski, Peter Shergold, who's the chair of CSI, and Christine Muir, who is the CEO of CSI. You can register at impact2020.online. That is it for today. Thank you again, everyone. I'll see you tomorrow. Okay, bye-bye.
Thank you. Bye.
Bye.